Good morning and welcome to the TPEA sponsored All About Social Security webinar. Our Lunch and Learn series continues today. We'll get started here in just a moment, right at the top of the hour. Allow for more people to join us. We should have a pretty full house today. So thank you for coming in here. We'll talk about housekeeping details and hear a little bit from Ray, and then introduce you to our special guest today that I'm pretty excited about. So we'll get started here just in less than a minute. Well, good afternoon. It is straight up noon, and we thank you for joining us on today's TPEA sponsored Lunch and Learn. Our series does continue today. We're talking all about Social Security today, a little bit about Medicare as well. My name is John Green with Association Member Benefits Advisors, or we go by AMBA as well. Joining us today on the call is legislative specialist, legal specialist, all those different type of things, Ray ML. So Ray is out in West Texas. He's been out driving around North and West Texas this week, sharing all about TPEA and meeting state employees and retirees out there as well. So we'll hear from him in just a moment. For those of you who are joining us today, everyone is in listen only mode. And what that means is if you have questions or have want to chat, you can put that in the chat feature or the Q&A feature. We'll pause periodically, address some common questions and things like that pop up as well. Because this conversation today is about Social Security, some of these questions may be very specific to your situation. We are recording the questions. We will create a transcript afterwards. Our special guest will be helping us answer those. We'll post those out on the TPEA website. I'll show you where to find those in a moment whenever we do get those posted out there. But we are recording this webinar to listen later on the TPEA website as well. So it's a great way to keep up with what's out there if you came in late, something like that as well. You'll notice the QR code down there at the bottom. We'll have this up at the end of the presentation as well. If you have any questions, anything that you'd like to discuss as it relates to maybe gaps that you have about your insurance, things like that you have through the state or through retirement, we can address those as well. You simply just use the camera feature on your smartphone and hover over that QR code, just like we do in restaurants today. So you can use that and pop up a little form that way. So Ray, we've got a lot of folks pouring in here. Why don't you kind of tell us, I think you're out there in West Texas right now, kind of tell us what's going on, what you've been doing this week, and how you've been spreading the message about TPEA.
John, thank you. Hi, everybody. And thank you for coming on the call on a beautiful Friday. Fall may be coming. Out here in West Texas, I've been out here with Gina Stannard, who also is the TPA membership liaison. And we were at a TxDOT fair or safety event, they call it, in Levelland. And they had people from the entire Lubbock region at this, and a few were retirees, excuse me, most were employees. And it was one of the first such events that TxDOT has had anywhere in the state. So we were so privileged to be able to attend it. I spoke to the assembled group, 300 or 400 folks were there. We also had a table set up and gave a few little door prizes. So it was very heartening to see us about 90% back to normal. And I hope that's a sign of times to come. And the previous week, we've been out in Gatesville doing something similar with folks in the training at the TDCJ facilities out in Gatesville. So we're getting out there again, and we hope to see some of you as we embark on trips across the state of Texas. But again, thank you as always for all you have done, especially during this time of COVID, the time of the freeze, the storms, et cetera, to carry out the missions that the legislature has given you to take the tasks to take on. So thank you very much. You are so appreciated, and TPEA is trying in every way we can to acknowledge and show and put the spotlight on what you've been doing. And now I'm going to talk a little bit about this third special session. Technically, it was a called session. So it was something where the governor put several items on the agenda in addition to what he had already put on in previous ones. But the one item they had to pass, the one set of bills they had to pass, had to do with reapportioning districts for Congress, for House of Representatives, for in both Congress and the state legislature, and the state Senate seats, their district lines, as well as the State Board of Education. And they did all of those things in this third special session. That was their primary activity, primary purpose for meeting. But they also had on the call or on the agenda an allocation of several $1 billion out of the American Rescue Plan Act, or called ARPA, which you remember the President Biden pushing through back in the spring. And that money was divvied up in various ways. But in right before this session, between the second and third, the TPA Board of Directors had met and approved a resolution supporting across the board pay raises for state employees, and giving us kind of a green light as your lobby team and Bishop, Executive Director, myself, to go over to the legislature and do all we could to try and get free up some money for that purpose. We did testify 4 separate times before the Finance and Appropriations Committees. We went by several offices to see people we knew who were involved in the state budget. We communicated in every way possible regarding the need to address state employee pay. And we were reminding them of how very long it's been since there's been an across the board increase. And even though the federal legislation was only allowing a one-time bonus, we were also testifying and communicating that would be something we would find acceptable if that was the only way they could put money into state employee hands. Now, such measures did pass the House of Representatives, the State House of Representatives. However, the Senate had not passed a similar provision. And when the bill went to what's called conference committee to work out the differences on allocating this federal money, the items got taken out that would have given money to the state. It was very disappointing. We are disappointed, and we're going to keep up our communications all through the interim before the next regular session of the legislature. So we're not giving up. We're going to continue our efforts, redouble our efforts. One thing we did towards the end of the special session was we put out a text alert asking you to contact your local legislator. And that brings up something that we're going to ask you to do today to be ready for the next time the legislature's in session, so that you could be your own best advocate by signing up for text alerts from TPEA. And all you have to do is text the word TPEA, to 313131. And when you do that, we will have you added to our list it's growing into the thousands of folks that we can put out an alert to. And believe me, we do not abuse this. We do not do this excessively. When we send out an alert, we do mean for you to contact your local state representative and state senator. So, and be on the lookout for more communications from us about issues of interest, and also about who is representing you, because that will change for many of you because of redistricting or reapportionment of the legislative districts. So you will need to know who your representative is and who your senator is, and we will be communicating that to you. So thank you again for all that you have done for the state of Texas and continue to do, and know that we're on the lookout for you. And as a final note, reminder, Senate Bill 321, the provisions that create a new class of retirement, will not go into effect until September, as far as affecting the new class of employees, until September 1 of 2022. So none of you who are now employed will be affected as far as your retirement benefits by this bill. What will be beneficial to you from this bill, of course, is that the retirement fund has now been shored up. And now we have a way to not only bring it out of debt, but put it in very solid position. And for those of you considering retirement who might be already retired and are on the verge of Social Security, know that ERS should soon enough be in a position for the first time in well over a decade to provide some sort of annuity increase. So that's a very hopeful note. And finally, your insurance is not changing. If you're a person who has just signed up for ERS insurance, or if you're about to as a Medicare retiree, those insurance plans will remain intact, and your copays and co-insurance will not change, will not go up. So, and there will be no real changes. It'll still be the very good plan that it is now. So, John, thank you, and I hope I haven't carried on too long, because I think you're all here for Social Security. So.
Ray, I appreciate it a bunch. I'm glad you enjoyed your time out there on the road with Gina and drumming up more, hopefully new members to TPEA, because that really is our goal, to get more and more members, because when those alerts do go out, then we can say we've got 10, 20, 30,000 people behind us there. As I mentioned, we are recording this webinar today. You can access all of this exclusive member content when you go on to the tpea.org website. You log in under member login, then you go to the screen that says members. And then from members, you'll see the little green button that says exclusive content, services and discounts. And that's where you'll start to see some of the content posted out here, these videos, the Q&As that follow up, things like that. So highly encourage you to do that. Again, if you have a challenge logging in, you can contact Gina Standard there at TPEA. She is the membership coordinator and liaison for you. So as we talked about, supporting you as members is our top priority at AMBA as well as TPEA. If you're not a member, please consider joining TPEA. $750 a month for active employees, $250 a month for retirees. If you're not an employee or a retiree and you just want to support what is going on with TPEA, you can be an associate member, gain access to the benefits that come with that for $2.50 as well. So all that we do, and this is the mission behind what Ray and Ann really wanted to bring to the table with TPEA, is to make sure that if you're not at retirement stage yet, that there are some things that we don't want to hear. We talk to retirees all the time, and we hear them say, I wish I would have known something sooner, or I had to work longer, or maybe cut my career short because something happened I wasn't prepared for. That's the purpose of these webinars, is to make sure that you understand what is out there for you, that you can make decisions that impact you, that you can retire in the manner that you want to, or live your retirement years, work your career as long as you want to as well going forward. So when the conversation came up, said we want to learn more about Social Security, we got a few questions from you beforehand. These are questions that we're going to address today, as well from our special guest today, as well as just talk about Social Security in general. When is the best time to start receiving Social Security? Should I take my Social Security or should I take my spouse's? What's Medicare? How do I get that? What do I do with it? And then one thing that I find really, really neat, my wife is a public school teacher in Conroe, that we have so many what I call public servant households, family members who work for the state, and then family members who work in public education, or people who worked in public education who now work for the state. And there's a lot of questions behind TRS, which is the teacher's retirement system, and how it works with Social Security. So we're going to answer a few of those questions today, but I do want to talk about, as we continue this conversation in regards to National Retirement Month, which is October here. You've all seen the conversation about the three-legged stool. You have your state of Texas retirement, which is a great pension system, and what TPEA did with this legislator this year to make sure that your leg in terms of pension is solid. That was strong work. That was huge on behalf of the TPEA for retirees and for future retirees. We've talked in the past about Texas Saver Program, your personal savings, that leg. We're going to talk about the Social Security leg today and what that leg means to you and how you can help you have a solid retirement. I want to introduce our special guest today. We're excited about Valerie Merkline. She is the Public Affairs Specialist for the Dallas region of the Social Security Administration. She does live in Austin, and she's got responsibility for the Central Texas area. She started her public service career in the U.S. Air Force, where she was a radar technician. So Valerie, thank you very much for your service. And then after she finished that, she came back to St. Edwards, got her degrees there at St. Edwards. And then she started at IRS and then moved over to Social Security back in 2003. So Valerie, I want to welcome you to our conversation today. We've got about 250 of our friends on here who want to hear everything that you have to say. So welcome today.
Thank you so much. And I am welcome and pleased to have 250 more friends in my life. I couldn't ask for a better thing, that's for sure. I do like to start off by making the joke that when I re-entered federal service after the Air Force, I did join the IRS, but then I realized I wanted to work for the people that gave the money away instead of collecting it. So it's been a really rewarding choice for me ever since. So Social Security, we're with you through life's journey. You may not know this, but nowadays, if you have a new person entering your family, you're actually getting your Social Security card for the child through the hospital now. Of course, that's a little different than when I got my card. I got it probably when I was about 14. And I remember thinking, what's this card for? Next slide, please. And we are with you through life's journey. So we're there when you're born. If you get married, you might change your name. So you're working with us doing that. You might have a loved one that falls ill. You might even lose somebody during your lifetime. But of course, we want to be there for your retirement and also there when you sign up for Medicare. Next slide, please. And who pays for Social Security? Well, that's all of us. We all pay for Social Security. Next slide, please. Of course, we're with you that very first day when you start work. Does everybody remember getting your first paycheck and thinking, wow, this is not exactly the amount of money I was promised? And then you look down on your leave and earnings statement and you think, what's this FICA all about? What the FICA is FICA all about? Next slide, please. All right, so FICA, of course, if you've been working for an organization that does pay Social Security taxes, then what we're looking at is 7.65 is taken from your paycheck, and it's also taken from your employer. So 6.2 of that is Social Security, and 1.45 is for Medicare. Now, this 1.45% goes to pay for your Medicare Part A only. And of course, the 6.2% is saved up and then used for a calculation on a dollar amount that you will receive every month for the rest of your life. Next slide, please. Okay, and what I need everybody to do is take a look at this chart because your information is going to be different than everybody else. Now, I'm going to be talking about everybody in general terms, but of course, we can see the timeline is different for everyone. Now, that top category, 1943 to 1954, that is our technical definition of baby boomer. And their full age, of course, is 66. Now, before 1943, if you were born, your full retirement age was 65, which is Medicare age. So we need to be aware of the fact that probably nobody on this call today has the full age retirement of 65. But you'll notice as we went past 1954, each year we added 2 months and 2 months and 2 months. For the culmination of anyone born after 1960, their full retirement age is age 67. So what I really need people to do is go ahead and select your full retirement age. Now, usually I'll be talking about 66 because that's the predominant, largest retirement group right now, the baby boomer generation. But be aware of the fact that your dollar amount will have a different timeline than everybody. And when we're talking about retirement, the timeline for Social Security is anywhere between age 62 all the way up to age 70. Now, you'll notice as time goes on, the further the full retirement age is pushed out for younger generations, the more of a benefit reduction they will have if they apply at the earliest moment possible, which once again is age 62. So you'll notice baby boomer generation, if they took their benefit at age 62, it is reduced by about 25%. And that is a permanent reduction every month for the rest of your life. And for those born after 1960, if they apply at the earliest moment possible, which is age 62, their reduction is higher by 30%. So a little bit of a difference, and you can see kind of the trend overall as time went on. we were trying to preserve the trust fund, and we knew that the baby boomer generation would be both taking benefits and also working longer. So we weren't really sure what those numbers would be looking like in the near future. All right, next slide, please. And here's just a very rough idea of what these numbers translate. These are not your personal numbers, of course. And once again, we're using the full retirement age of 66. So this would be a baby boomer generation. If they take their benefit at 62, it would be reduced by about 25%. If they wait until 66, which is their full retirement age, not necessarily yours, it would be 100%. And their benefit, if they don't take it all the way up to age 70, you'll notice on average it's about 8% each 12 months that they wait and they hold off on taking the benefit amount. Now, a lot of people have a misconception that if they take their benefit at age 62, when they receive their benefit, they are going to, at age 70, switch over to a higher dollar amount, and that is incorrect. Whatever timeline you choose has to do with the dollar amount that you will receive from Social Security every month for the rest of your life. So this is a very important decision. This is something not to make made lightly. This is not something that we can tell you how to think about or how to approach, but we do have some guidelines. For example, we've been with our bodies all of our life, and we kind of know our health benefits, we know our health conditions and any serious challenges that we have to that. Also, we might know our grandparents' age when they passed away, perhaps our parents' age. We have aunts and uncles, cousins, siblings. All of these things point to a certain timeline that, even though we don't like to have this conversation with ourselves, it's pretty necessary, because most financial providers would say plan for the worst case scenario. And the worst case scenario is that you're going to live an awfully long time, which doesn't sound bad, but it can be if you run out of money somewhere in between here and there. So this is something very serious. Now, if you are from a very long-lived family tree, of course, waiting until 70 for that higher payable dollar amount each month for the rest of your life, that might make some good financial sense for you. And then conversely, if you come from a very short-lived family tree, then of course, getting in there at age 62 and receiving your payments back out again, that could be an important strategic decision for you. So this is a timeline. The timeline that we're taking a look at is 62 to 70. And this is how choosing when your benefit will dictate the dollar amount. So once again, a very personal and private decision. And as we transition to the next slide, we're going to talk about adding work to this equation. So you can work and receive a benefit from Social Security. However, how much work you perform will dictate what dollar amount you receive from us. So once again, we're looking at the timeline before full retirement age, which is age 62, all the way up to the month that you turn your full retirement age. In any year that is under your full retirement age year, you are going to have a limit, and that limit's pretty small. It's $18,960 for this year. It does usually go up a little bit each year. And what we're looking for is, this is work performed for wages. This is not you getting an Air Force retirement. This is not you moving money from 401k into some other investment. This is not you selling a herd of cattle and making a profit. This is not you selling a piece of property and making a profit. This is work performed for wages. So this is something you would see on a W-2 statement or on a Schedule SE if you are self-employed. And if you were going to be well and above this $18,960 annually, and you're only age 62, you might not want to start your benefits because you might not receive anything from us. For every $2 that you go over that limit, we hold back $1 in a benefit. So for example, if I'm going to be $4,000 over this limit at age 62, Social Security will divide that in half and say, okay, $2,000 is what we would hold back in benefits from you. Now, that might be my first check from Social Security. That might be my first 2 checks, but then I'll get a check every month for the rest of the year. That might make good financial sense depending on what else is going on. Now, if I'm well and above over this 18,000, if I'm making 40 or 50,000 a year, I have no intention of retiring. Well, then I'm not really meeting the qualifications for being eligible to receive a retirement benefit. Now, you'll notice the very year that you turn your full retirement age, you are going to see that the dollar almost triples. The dollar amount, the doorway just gets a little bit wider. And you only have this limit from January 1st until the month before you turn your full retirement age. And once again, let me give an example. I was born in April, so my full retirement age will be 67. And I will have this annual limit, this 50,000 in whatever future dollars that might translate to. And I will have it from January 1st until March 31st, because the very first day of April, which is my birth month, I'm going to be able to work and earn $1 million a day. At that point, Social Security just doesn't care. If you've made it to your full retirement age year and month, there's simply no limit on how much work you can perform. Now, keep in mind, while you're still working, you are still paying Medicare and Social Security taxes on your wages. So you are still contributing through FICA. You're just also receiving on the other side. So that's a little bit of the timeline. There's some cues. Of course, the intention for us is that if you can afford to wait, that you wait and get the highest dollar amount that fits into your financial plans. And also the work rules that go along with this. You'll notice they're just a little bit different. And the culmination being, once again, if you wait until your full retirement age, there's simply no limitation and there's no hesitation in paying you your full benefit every month for the rest of your life. So we give you encouragement. We're a little worried, like most financial organizations, that we are not saving enough as Americans. And we're worried that people are going to end up in a situation where they're just solely retired using Social Security. And we all know that that wasn't the purpose of Social Security. The purpose of Social Security was to be either one leg of 3 foot of stool, or 4 possibly, depending on what you've got going on with your avenues of investment. So we try to make these rules a little bit more helpful for defining your retirement, but ultimately you are the one that makes the decision on when to file, because that dollar amount is so essential to you and your other financial makeup. All right, next slide, please.
Valerie, I want to stop just for a second because we had a really good question, because just about everybody on this call is going to be receiving a state pension at some point in their career. Pensions do not have an impact on the reduction or anything like that. It's only earned income. Is that correct?
That is absolutely 100% correct. This is only work performed for wages. What we are trying to define is, are you working or are you not working? Because that the whole point of this retirement insurance benefit is the fact that you are no longer working. So it's meant to supplement something that's no longer there in your life.
Okay. So it's about income, not about your pension related in any way, shape, or form. So
no. All righty. Were there any other questions?
I think we're good right now, so we'll keep rolling.
Okay. All right. Sure. So I'd like to talk a little bit about one calculator in particular. The retirement estimator will show you very specific timelines, and this does engage with your earnings record. So this is your personal information. The retirement estimator will show you what your benefit is at 62 and 4 months, or 64 and 7 months, or 67 and 3 months. Whatever timeline you'd like to look at, this will show you what your benefit will be. And in addition to this, for some individuals, if you are going to retire before age 62, Our calculators don't know any different. We think for benefit estimation purposes, we think that you are going to work every year up until age 62. So let's say, for example, if I was in a position where I could file for benefits, for retirement benefits through my employer at age 55, the last 7 years of earnings, Social Security will estimate that I'm still working those last 7 years for an estimate. Now, with this retirement estimator, you can go in there and change those last 7 years, year 56, 57, 58, the last 7 years all the way to age 62 as zero, and it will give you an even more finite definition of what your benefit will be. And it most likely will be a little bit lower because, of course, when you're at the height of your career and you've been in the position the longest, you're usually earning the highest point potentially you can as an employee. And if you're retiring before filling in those last 7 years, we don't know about that. So this retirement estimator can get you just more succinct information. And honestly, that's what you need when you're trying to work with all the different other avenues of investment, is to figure out what dollar amount do I need to give in combination with all the other things that I have going on. All right, next slide, please. We've got some other online calculators. We're going to talk a little bit about WEP, that windfall elimination provision. There's also government pension offset. Those are some really good calculators. You can do all of the calculating at home. You don't need Social Security to tell you anything. The other one I like to point out is the fact that the life expectancy, just to let you know, the federal government does not know how long you are going to live. However, based on actuarial charts, there are 2 bits of information that this life expectancy calculator goes on. One is your gender. The other is the year that you were born. So if you go to the life expectancy, it's just going to pull up an estimate based on things that we already kind of expect to happen in our lives anyway. But it gives you a really good launching point to have that uncomfortable conversation with oneself about not only how long you're going to live. That is not the true meaning of this. The true meaning of this is to show you how many decades of life you should plan for without a viable work income, and have you invested enough in other things to beat things like inflation and medical costs are rising always. All the things that we know are going to be there in the future, have you planned for all of those things? So if it's 2 decades or 3 decades, if grandma and grandpa live to be 95 and mom and dad are heading into their hundreds, you might want to think about holding off your benefit until age 70. Now, of course, at age 70, it doesn't get higher, so we hope that you take it at age 70 if you do intend to take a Social Security benefit. Next slide, please.
All right, I want to stop you again, Valor, because we had a couple of questions come in related to this.
Sure.
If someone waits until age 70 and doesn't claim their Social Security to that point, do they receive any of these cost of living increases in the time that they didn't take their? Will their Social Security be figured out based on all those cost of living increases that have taken place up to that point? How does that work?
Yes, it would. The cost of living adjustment is applied to every year that you don't take your benefit and you do take your benefit. So it's a new updated dollar amount every year after the cost of living adjustment is voted on.
Okay. And then we had a
question. So you don't lose anything. You don't lose the benefit of the cost of living adjustment by not taking it
by waiting
sooner.
Okay. Excellent.
Correct.
So we had one of the questions similar to that, about the increasing limit or the income limit that would allow people to work part-time. Does that increase every year? How does that work? That maybe some folks may still fall under that 18,000.
Yes, it does. It usually goes up a little bit. It usually goes up according to the cost of living adjustment, which has just recently been announced. It's 5.9 this year, which is very large, according to all previous years, basically. And so yeah, it goes up a little bit. The Medicare premiums usually go up a little bit. So everything's designed to kind of increase along the same timeline as the cost of living adjustment.
All right. Thank you very much. And we'll keep rolling on here.
All right, so we're going to transition into Medicare. Now, if you still have Social Security questions, go ahead and hold on to them. We can wait until the end. Medicare is just going to be real short here towards the end. So let's go ahead and talk about Medicare now. Of course, Medicare Part A is that 1.45 that you've been telling or hearing about, is that 1.45 that you contribute through taxation. And Part A is hospital insurance. Part A is a minimum 3-night stay in a hospital. So something pretty drastic is happening, of course. Part B is medical insurance. This is everything else. This is dialysis. This is, oops, I fell and sprained my arm and now I need an MRI. Oops, now I need physical therapy. Or if there's some minor day surgery, this is your cold and flu checkup. You know, this is your annual checkup. Part B is pretty much all the other doctor visits. Part A is in a hospital. Now, Part A and Part B, you sign up with Social Security. And when Medicare was created, Medicare Part A in the mid-1960s, I'm sure they thought about opening up Medicare offices all across the nation to handle enrollment. But then they looked around and they said, hey, look at all these Social Security offices. They're pretty much in place. And I'm sure we said, no, we don't want to have anything to do with this, but we lost that coin toss. So unfortunately, or fortunately, you sign up with Medicare Part A and Part B through Social Security. But keep in mind, they are a complete and totally separate federal entity. So once you start working with Medicare, you are working with them. You won't work with Social Security to handle billing or what things are covered under what plans and all that. That is a separate federal entity. So Part A and Part B, you come to Social Security. Now Part C and Part D are offered through private companies. So these are things that you will have to check out on your own. And Part C is the Medicare Advantage plans. They've got all kinds of different ones. And then the Part D is the prescription drug plan. Once again, all kinds of different companies that will want to sell you things. Now, one of the things I can tell you about the fact is you approach 65, and you've probably seen maybe aunts or uncles or parents approach age 65, and you're just going to get a terrifying amount of mail. It's a lot of mail. There's no way you can't be slightly or mildly panicked about the amount of mail that you are going to get when you turn 65. Good news is it kind of prompts you to start thinking about Medicare. Bad news is you're just going to get a lot of mail. So you're going to be looking through stuff. They make their stuff look exactly like Social Security and Medicare packaging. So some things you're going to have to open up just to be sure it's not Medicare or Social Security. But I do know that most of you, usually when we see people retiring through the TRS or ERS, we don't usually see people taking on any more coverage other than Part A and Part B, because your retirement package health insurance will include things like C and D. So we don't usually see people taking part in many other plans, maybe only if you have something very specific health-wise that you need extra coverage for, but you would be aware of that because, once again, you've been with your body all of your life, so you know the certain health challenges that we have. All right, so that's all the different parts of Medicare. From here on out, we're going to pretty much be focused on Medicare Part B and Part A. Next slide, please. All right, Medicare eligibility comes in many different forms. The most common one, of course, is age 65. We all know age 65 for Medicare. But there are some other ways that you can become Medicare eligible. If you are ever diagnosed with ALS, otherwise known as Lou Gehrig's disease, you will have immediate access to Medicare. Also, if you suffer from kidney failure, this would be a kidney transplant or kidney dialysis, you'll be immediately eligible for Medicare. And for those that are younger than age 62 and find themselves having a disabling condition, you might apply for disability well and above retirement years. And with disability, 24 months after your first payment of Social Security disability, you will have access to Medicare coverage. Now, the last category, environmental and hazard exposure, this is mostly up in Montana. There were some individuals that were assisting in cleaning up Superfund sites and got exposed to some hazardous materials up there. So they are eligible for Medicare eligibility as well, but we don't really see that too much here in Texas. Next slide, please. Okay, here's the most important thing about Medicare. If you all get this or watch it later or take a picture of it and mull this over, this is very important information. And this is very important information, the kind of thing I wish I had known. I wish someone had explained this. I wish somebody had taken a moment to show this to me, because it makes a lot more sense now. This is that moment in the presentation. So initial enrollment is, of course, like I said, 65. We all know that, right? You have as much as 3 months before the month you turn 65, the month that you turn 65, and as much as 3 months after age 65. Now that's 7 months to sign up for Medicare. And that might be Medicare Part A, or that might be Medicare Part A and B. How do you decide? Well, initially, if you are turning 65 and you are working and you have work health insurance, or your spouse is working and they have current health insurance, you basically may or may not take Part A. You've already prepaid for it all of your life, so take it, don't take it. For us, it doesn't really matter. That's your decision. However, the Part B of Medicare, you will not sign up for Medicare Part B if you or your spouse is working and your health insurance is coming from that current work. Now, you're going to hear me say current work about 500 more times, because that is essential. Current work, not your benefit through a retirement package, even though you might think, well, that is health insurance for the work I performed. Technically, that's true, but it's not for current work. So if you are approaching age 65 and you are not working and your spouse is not working, you need to sign up for both Part A and Part B. If you or your spouse is working and your health insurance is coming from that organization for current work, you won't be signing up for Part B during the initial enrollment period. And you would think, well, wait, Valerie, doesn't that mean I'm going to get penalized later on? No. Essentially, you have something called a special enrollment period. Now, the special enrollment period is for the people like yourself, or if your spouse is providing health insurance for you through current work, they are not signing up at age 65, but you know you need to sign up for Medicare Part B at some point, and that point will be the month that the work stops, 1 month before the work stops, and 6 months after the work stops. Now that's 8 months of something that we call a special enrollment period. Why is it 8 months long? Because you don't want to miss it. This is very important for you to get right. And by get right, I mean, don't end up in a general enrollment period, which we're going to cover in just a moment. You don't want your worst enemies to end up in the general enrollment period. So you have to be aware of the timeline. A special enrollment, once again, you're 65, you're working, your spouse is working, your health insurance is coming through that employment, and then you go past 65. So now you're 67 and you're retiring in October. So you have the month of September, the month of October, and 6 months after that to sign up for Medicare Part B without a penalty. And then that is your special enrollment period. Okay, so I think I said current work enough. So that's the special enrollment period. Now, the general enrollment period is, oops, I turned 65 and for whatever reason, I didn't notice the amount of mail I was getting. Or, oops, I was working, but then I stopped work and I didn't even think about health insurance. Well, this is the bad situation. It's not bad, but it's not good. So the general enrollment period is only from January 1st until March 31st. Now, if you're having health difficulties in October, you have to wait until January to March 31st. And even when you sign up for it, it will not start until July of that year. So not only are you not getting the health coverage when you want it, also for every 12 months that you go past age 65, you're paying a 10% penalty on that Part B premium every month for the rest of your life. Now, 10% is pretty high, but I've seen 100%, I've seen 150%. I've seen 200%. Very extreme cases where people just simply were living the best life possible and never had any medical treatment and therefore never knew that they lacked anything. So this is kind of the whole way everything goes. Age 65, take a look, what's going on in your life. If you're not working and your spouse isn't working, you're signing up for Part A and Part B. The age 65, because it is so similar to age 66, which is full retirement age for baby boomers, we end up having a little situation where people want to sign up for Medicare, but not for full age retirement benefits. Now, the Medicare standalone application through the website takes anywhere from 5 to 7 minutes. The hardest question is, what is your address? We just want to mail the Medicare card to you. That's how hard it is. You just say, yes, I want Medicare. Do I want Part B? Yes, because I'm not working. No. If you say no, we go, why aren't you taking Part B right now? Is it because you're working or your spouse is working? And if you say yes, we go, okay, they know what they're doing then. That's fine. And that's great. Now, if you insist on saying no, and I don't have any health insurance, we're going to have to contact you and document your choices a little bit more carefully, making sure that you understand special enrollment or initial enrollment. So those are some of the things to take with you as you head into Medicare enrollment eligibility. Next slide, please. For those of you that are going past age 65, when you do actually enroll in your special enrollment period, there are 2 different forms that you need. They're both Centers for Medicare and Medicaid Services, CMS 40B and CMS L564. Now, the 40B is the easiest form ever in federal history. It just says name, date of birth, social security number, and it has a big box that says, I want Part B. And you check that and you sign it and date it at the bottom. Easiest federal form ever. Now, the L564 is something that has to come from your HR department. Your HR department will select when you started working, when you've had health insurance, the fact that it continued past age 65 to a certain month, and then that month will be your open enrollment for your Medicare Part B. So 2 different forms, one you fill out, one your health insurance fills out, and then those are submitted to your local Social Security office. Next slide, please. All right, this is our website. It's very lovely. It's bright. It's very streamlined, very straightforward. There's only about 5 or 6 buttons on this whole page. In the lower right-hand corner, I do like to point out the frequently asked questions section. Guess what? Everybody that's ever filed for retirement benefits has all the same questions that you have. And if everybody's already done their homework and looked at all these questions and written them up, we provide them to you. Some of your questions are going to definitely be in there and they'll already be answered. So that's a really good place to go ahead and get started. For those of you that are going to be affected by windfall elimination provision or government pension offset, there's a search function in that upper bar. You can go to search, you can type in windfall, and it'll take you straight to the page where you can do the calculation. And it's very clean, very straightforward. Next slide, please.
Valerie, can
Yes.
since you brought that
Of
up,
course. Okay.
let's talk
Should we
about
talk
that
about
real
it?
quickly. Yeah, let's talk about WEP and teachers and public servants and Social Security and all that fun stuff.
Okay, so windfall elimination provision was a law that was created in the early 1980s, and it had to do with, we had lots of different organizations that were paying Social Security and weren't paying, and most of them were government institutions like ISDs, fire departments, police departments, federal employees, colleges, community colleges, all different levels of governments. And in the early 1980s, they decided, look, we need to, for the people that aren't contributing to Social Security, if they have their 40 credits, the way that we do the calculation is a very social calculation. So it might not surprise you that people that don't have a great performance report work-wise are actually going to get a whole lot more out of Social Security than they ever paid in. And when we take a look at somebody who didn't do well in our society, and that's the whole point of Social Security, is to uplift people that are in poverty. When we take a look at an earnings record from somebody who simply doesn't pay Social Security taxes on their wages, we give them that artificial windfall of a calculation for someone who might have been disadvantaged in our society, but this doesn't actually fit that individual. So employees, federal employees before 1982, they do not pay Social Security taxes. Everybody after 1982 in federal service does. But then the individual counties, states, governments, like I said, police departments, fire departments, schools, UTs, community colleges, ISDs, everybody got to make a decision of whether they were going to contribute or not. And if they do contribute, then they do pay that 6.2 to Social Security. If they don't pay, then that 6.2 hopefully is going to some other investment. We just don't know what it is. So there's an artificial calculation that is used to bump up somebody who looks like a poor performer in our society, and that's called a windfall. So the windfall elimination provision is stripping the calculation of that artificial windfall that is pushed onto their record, because this isn't somebody who's disadvantaged. This is somebody who just didn't invest in Social Security. So it's used to correct that. Now, that's not good news for individuals, of course, that don't pay Social Security taxes. And if you don't have your 40 credits, you're not insured for Social Security. If you do have your 40 credits, you have to, by law, receive some dollar amount from Social Security. It just won't be the dollar amount that we might have been telling you. And it's usually reduced by about 60%, usually. So if you wanted to do a rough calculation in your mind and you've got your Social Security statement and it says, hey, we're going to pay you, $100 each month. You might want to reduce that by 60 and you'll get $40 from Social Security. And you'll still get that every month for the rest of your life. So it's not all bad. What I usually hope for is that it's going to at least be high enough to cover that Medicare Part B premium. That way you never have to see the bill. And that's usually what ends up happening, is it does end up being just enough to cover that bill. So that's windfall elimination in a nutshell. It is something that if you have your own benefit with Social Security, you will receive something from us. It just won't be what we thought it would be. Government pension offset is for a spouse on someone else's account. So this is a survivor benefit, or this might be a spouse's benefit. And that calculation is a little bit more simple. And once again, you can use the calculators. What we take a look at is if you are applying for spouse benefits because you don't have benefits on your own record, your benefit, we take a look at what is higher, what is the spousal benefit versus what is 2/3 of your pension from the state. Now, once again, this is only for individuals that did not pay into Social Security. So keep that in mind. That will affect your benefit on someone else's account. That's the government pension offset. Two totally different laws that affect two different benefits. All right. Hopefully that's not dabbling too much. I do a much longer, more extensive version if you all ever want to have me back, and we can just talk about weapon GPO for an hour. Trust me, I can go backwards and forwards with it. But just to make sure you all understand, this law doesn't affect everybody on this call today. This is only for individuals that worked for an organization that did not pay Social Security taxes on their wages.
Great. Thank you very much. Because we're
You're
bumping
welcome.
up near the top of the hour, what I want to do, keep those questions flowing in the Q&A. I'm going to ask Valerie to hang on after the webinar and answer some of these questions. So if you've got a specific question out there and you can hang, she'll do that. We'll also, again, record the transcript, put it out there on the webinar, on the website as well. I do have just a couple of quick questions before we move forward here, kind of generic in nature. How do I pay for Medicare before I start taking my Social Security payment? So if somebody wants to wait until they're 68 or 70, but then they take Medicare and start getting that at 65, how do they make those payments in the interim?
Absolutely. That is an excellent question. You've got quite a few different payment methods. If you are approaching age 65 and you have already filed for retirement benefits, when you turn 65, you will be automatically enrolled in Part B. But of course, in this scenario, we're looking at somebody who hasn't started benefits, but needs to start Medicare and paying for that Part B premium at age 65. And you've got a variety. You can have an automatic bank draft. You can put it on a credit card. You can put it on a debit card. If you were retiring through the federal government, you could have it pulled from your OPM pension, but that's not a scenario for you all. So there's a variety of different ways. And once you get your Medicare card, it will have you select the kind of method that you would like to do as far as a payment. And so you set that up yourself. But when you start your Social Security payments, that very first payment will have the Part B taken from it. And this can get a little bit tricky. So just a little bit of information. As you transition from only Medicare to Medicare and a retirement benefit, make sure you're not paying. I know sometimes people like to just pay the bill for the year or every 6 months. As at a minimum, they would usually like every quarter, so every 3 months. But be sure that as you approach your payment date, that you haven't paid like a year or two of Medicare up front, because no matter what, they will still take those premiums from your Social Security payment. So they'll give the money back eventually, but I always feel it's better off in your pocket.
Exactly. All right, we'll take one last live question that we have here. Keep those questions coming in the Q&A. Again, Valerie, if she can hang, she'll answer them live for you via text, but then we'll record all the answers for later on like that. We have one talking about work after you start to claim Social Security. The question was, if you claim Social Security, say at age 62, so you're starting to get your reduced amount that you've got coming, and you keep working and you're still continuing to pay FICA, do you ever increase your Social Security payment because of that FICA that you've paid after you started receiving Social Security?
Yes, twice a year we do something called an arrow adjustment. Once in, I believe it's mid-year, so like June, July, and then again in December, we do an automatic reshuffling of the numbers. And if you've had work added to your earnings statement, then we have to redo the calculation to give you the benefit to see if it's one of those top performing years. And if it is, then we come back. If we just did the equation again in mid-year, we go, oops, since January, we should have been paying you, $12 more each month. Here's the back payment for that. And here's what the payment will be going forward into the year. So we do look at the number and then go, okay, yeah, we got to throw out year 1982 and, add in year 2021.
Okay, great.
John, let me make one quick comment, and just, it's not necessarily a question, but Valerie, there are people on this call who have a considerable amount of both ERS, Employees Retirement System, credit towards their pension with the state of Texas. And of course, they are just your standard participant, the state has been in the Social Security. But you also have a lot of folks who came out of school who had maybe school district time, or even, as you've mentioned, community college time, and they can conceivably consider retiring and receiving a pension under TRS. But they can make a decision at retirement age to retire either under ERS or TRS. It would seem that they need to, at that point, give careful consideration to some of the windfall elimination period effects and government offset effects that you've mentioned, its effects possibly on their pension if they're going to retire under TRS. Would that be a fairly succinct a summary of what they need to, of the consideration they need to take into play?
Well, it won't, anytime, let me say this carefully, anytime that you are adding years in the calculation for ERS or TRS, it's not the definition of ERS versus TRS. It's not the definition of the pension. It's the actual years that are used in the calculation for that pension. And if you're adding years from a school district that did not pay Social Security, even though you might retire under ERS, if you use those years in the calculation for ERS, there will still be a little bit of windfall affected. But of course, the years that you do pay Social Security are going to offset that. And the more years that you did pay into Social Security, the less of a reduction you will have for windfall elimination provision. So it comes down to years of coverage. And once again, that windfall elimination provision calculator, it has you go through and list every year that you did pay Social Security taxes, and it tries to get you a higher dollar amount because of that.
Okay, thank you. That's very good.
Thank you, Valerie. We appreciate you very much. Is there the best way to reach out is probably to go through the website to get those individual conversations started? Is that correct?
Yeah, setting up your My Social Security account. Hopefully people have done that. We're not mailing those statements to you anymore, so you haven't seen that in a while. We do it for certain age groups, but we used to do it for everybody straight across the board after the age of 24, but we don't have the money to mail those out to everybody. So the solution that we have is that My Social Security account, and the fact that you can go and look at all of that information for yourself.
Okay, great. Thank you very much. We are going to get you back because we do want to dive into that WEP and government pension offset situation. So thank you for joining us, Valerie. Well, as we roll through here, we're at the top of the hour. Again, this is why TPA is here to help you, to make sure that you understand what's out there before you retire, even after you retire. Protect those pensions, protect those funding levels for your salaries, as well as for your benefits. That's what AMBA is here for you as well, to make sure that we help fill those gaps that aren't covered by your benefits, that they're portable if you leave state employment for whatever reason. Extend them to your family members for whatever reason as well. And there are some gaps in there, even when you go on Medicare, that may not be covered for you. So we'll talk about some of those things available to you. We have our two most popular webinars coming up in November on long-term care. Make sure that you pay attention to the webinar schedule that's out there, the emails that come to register. You're doing a phenomenal job doing that. Look forward to having you join us for that as well. I'm going to leave this up here. We're going to stop recording in just a moment. If you have questions specific to Social Security and Medicare, put those in Q&A and Valerie can start answering those questions for you. We'll roll through that. If you have questions and you want to review what benefits you have available to you as a TPEA member, and if you've got questions about how Medicare works and those type of things in regards to what is not covered, please feel free, take out your phone, open up your camera feature, hover over that QR code, hit that up, and just put benefits review or long-term care, some of those things that are not covered by Medicare, and we can help talk to you and have someone give you a conversation as well. Valerie, thank you so much for joining us today. Ray, thank you so much. Have a safe trip home. Everyone have a great weekend. Again, we're going to stop recording. We will have this recorded transcript with all the answers that Valerie puts back out there for questions will be available on the TPEA website in the near future. But But if you want to hang on around and Valerie can maybe answer that question live in your question and answer feature, feel free to do so. So again, thank you very much and have a great rest of your weekend.